Hello and welcome, I'm Delia Dolor. Through a series of programs, I'll introduce you to many of the services, achievements and future improvements to St. Lucia's health system. During the making of these programs, I realized that I held many perceptions of what the health service was all about, and I was surprised to find out about the many services available and the areas of expertise health professionals employ at our hospitals, polyclinics and wellness centres. I also talked to people responsible for planning our health system, from the Minister of Health and Wellness, Senator the Honourable Mary Isaac, to the providers of quality health care. This programme also features Creole interviews with Fennell Neptune, and we'll ask you questions and give you their answers immediately. And I know you'll get them right? Let's learn more about St. Lucia's Health Service now. The Health and Wellness Minister says health personnel understand the importance of confidentiality, and she commends health workers for their service and commitment. Understanding how strategic governance works, community and mental wellness health services explained, and the importance of preventative health. But first, public not aware of many services on offer. A wide range of services are provided, not only at hospitals, but also at clinics, wellness centres and outreach programmes. Anyone can attend these health services no matter where they live. St. Lucia's health personnel are not as qualified as international teams. St. Lucia's medical professionals and staff are trained and retrained in St. Lucia and internationally. This is an ongoing procedure and a job requirement. People with mental health issues are demonized. Yes, people still think that way, but they couldn't be more further away from the truth. The stigma of healthcare is the problem. Mental health issues can be managed. Regina, when it comes to St. Lucia's healthcare, what improvements have you seen and what would you like to see in going forward?
I have noticed with suicide and depression becoming more of a concern in this country that there's been more attention to that area. I've seen a lot of advertisements and on social media and even on commercials about counseling and treatment for different types of mental illness areas. So as far as what I would like to see, I've also heard a lot of reports on elder abuse, and particularly with people who have Alzheimer's and dementia. So I would really like to see awareness in this area. There's no cure for it, so I believe that with all the research and evidence out there that we can find ways to prevent the risk factors of developing Alzheimer's and dementia. And if we can reach it from that end, that lowers the numbers in the next 20 years, because St. Lucia is also part of a group of countries that are higher risk for incidents in the next 20 years. Our aging population is a little bit, it's more older and then younger. And since we have, most of the Caribbeans actually have families who are abroad, and so that even leaves less people to care for those. So there's areas in that same area is the people affected with the dementia, the families who are caring for them, and then the professionals who are caring for them. And there needs to be a lot of tension with all of it, because it's not just an individual condition, it's not just a family condition, it's a community condition. And it's not just something that the government has to do. We all need to do it too. We all need to participate and help.
Thank you. Okay. Producing this program helped me to understand the functions and services the Ministry of Health and Wellness provides. It enforced very quickly how I relied on my common sense and level of intelligence and what acquaintances told me, and so I made assumptions about the health services available to me. I say this to you to prove that if I didn't go straight to the source of information, I wouldn't know the facts. I assumed that St. Lucia's health system could not provide adequate diagnosis, wasn't able to plan proper care, and thinking about the finances of it all was daunting. I was placing full responsibility of my health education onto the ministry. Are we in the same boat? Fact is, we have a responsibility to ask questions about our health care. Let's pay a visit to the Minister of Health and Wellness, Senator the Honourable Mary Isaac. Hello, Minister. I'm so glad that I had the opportunity to speak with you, because during the producing of these videos, I recognized that Ministry of Health must be one of the most important, perhaps it is the most important ministry, because without our health, we can't work, rest, or play. Now, as the Health and Wellness Minister, the buck stops with you. How do you decide how you need to go ahead with your remit? How do you decide about the strategy that the ministry should take?
Well, you know of the incidences of NCDs in St. Lucia, and one that is on top of our list is the whole issue of diabetes. So we have a whole long list of people waiting to get dialysis in St. Lucia. And what we have done is we have increased the amount of people that we can see on a regular basis, we can dialyze on a regular basis. So we have extended our care to provide an additional shift in the dialysis units. And this, I believe, is a great accomplishment, because we have been able to take on a lot more patients who are waiting to get care in our dialysis unit. So that is a major accomplishment, not only for the ministry, but for the patients and for the entire country. The ministry have always had plans, because all the government ministries have plans, they have strategic plans and so on. But what we found when I came into office is a very scattered system. It's very chaotic, and there does not seem to have any kind of methodology to really address a lot of the issues that we have in healthcare. What we are doing right now is we are putting together a plan that is very holistic, a plan that starts with primary care, in order for us to address a lot of the care that we need at the end of the spectrum. So we are focusing more on primary care and also looking at the issues that we have on the ground right now. So it is a very holistic plan that we have for healthcare. And I think that our healthcare system is in a much better place right now. You have a lot of issues because we are encountering a lot of issues, and what is happening now is we are actually bringing them to the fore. They are actually coming out, and we have to deal with them because they have become so big, So in dealing with some of these issues, we have decided that we must focus on everything in healthcare at the same time, because you cannot look at the end of the problem before you look at the source of the problem. So like I said, primary care has to be strengthened, and then at the same time, simultaneously, we are taking care of the current issues. So it is quite a burden that we have to deal with when you're looking at healthcare in St. Lucia. You know that we have the OKEU. We are transiting from Victoria Hospital into OKEU. OKEU has a lot more equipment. It will require a lot more human resource capital. It will require a lot more finances than we have currently. And those finances have to come from somewhere. So all of these challenges we have to be able to deal with, and we have to be able to deal with it all at once. So this is taking some time because it is a humongous task. We have never in our history had to transit from one hospital into a hospital that is, this is a state-of-the-art hospital. And although we have spent a lot of money bringing it up to what it is supposed to be, we are still continuing to spend money so that we can have a product we can move into, and when we move into it, it will function properly. So our plan includes all of these different issues. We are looking at infrastructure, we are looking at human resource capital, we are looking at finances, you name it, and we have to deal with it at this point in time.
I've met doctors, nurses, administrators, so many people who work in the healthcare system, and I was amazed by the compassion, the passion, everything that they go through. And I think sometimes the public forgets that the service is provided by people just like them. Can you speak to that?
You are quite right, because right now we have the highest amount of, I would say, sick people on our hands to take care of. Our NCDs are at an all-time high. We have other diseases that you are looking at, and finance in terms of agencies financing healthcare is at an all-time low. You do not have so much coming from the EU, coming from the US, coming from those other international agencies that used to assist before. So most of it has to come from government purse, and that is where our doctors and our nurses come in. They understand the situation that we are in as a small island state, and these people come in on a daily basis. They give their all, and they go over and above the call of duty to serve our population. They are doing so with very limited resources. As you know, Victoria Hospital, the old plant, is in terrible shape. And no matter what happens, they hang in there and they provide the services for the people of St. Lucia. So these people really have to be applauded. We do have one or two bad apples, but that does not come close to the amount of hard-working people we have in that system that is causing it to function as efficiently as it is right now. I think a lot of times there's a lot of negativity going on out there about the Ministry of Health, but we must understand that that ministry deals with a very critical subject, and patient confidentiality is very, very high on our agenda. Sometimes things come out and we really cannot expose certain information to the public, because you are dealing with people who are already sick. You are dealing with people who are already in a mental state that necessitate that we be sensitive about the issues. So a lot of times you hear all the negativity and people are not sensitive enough about the area that the Ministry of Health staff serves. So, and given our, like I said, our limited resources and the marvelous work that these workers are doing, the Ministry of Health is really very pressed in terms of staffing, in terms of the resources that we need to do the job. And, people tend to just take the negativity and spread it all over the place with little regard for the work that the ministry is doing. But I would want St. Lucia to look at all the positive things that's coming out of the ministry, all the help, all the assistance that we give to everybody who is in need, who come to us. We help them in one way or another, whether it is to give them free medication because they cannot afford to pay for the medicine, free surgery because they cannot afford to pay for it, whether it is to call on doctors and nurses to assist them in one way or another, giving a lot of charity to a lot of people in St. Lucia. I think that we as a people, as a country, ought to be very, very grateful that we have the workers and these people at the Ministry of Health who do not just go out there and blab people's business, because they recognize that people's business, the business that they deal with, the people that they deal with require us to maintain a level of confidentiality.
I have a question for you now, with the answer provided right afterwards, followed by the Creole segment with Fennell Nutty. Question: what is one of the major achievements of the Ministry of Health and Wellness? Is it A, extended care for diabetics, B, knowing the number of patients being treated in hospitals? The answer is A, extended care for diabetics. Extended care for diabetics is an achievement not only for the ministry, but for the large number of people suffering from diabetes.
Lei veni pou kalite la vie moun, santé se yon ki tou important. Se pou raison sa la, ministre pour santé ni responsabilité pour assurer policy santé pays en ordre. Ministre pour santé, sénateur honorable Mary Isaac, parlait des achievements yo au ministère de santé.
Nous avons un shy achievement dans le ministry santé. Ce n'est pas juste ça, mais c'est ça, tous ces gens qui travaillent dans la ligne de santé. Les regardez quand les gens qui sont malades, c'est actuellement là, nous avons un shy qui a présenté et puis toute qualité de différentes maladies. Et puis nous ni pour ça mettre bagay en place pour ça occuper ces monde ça là. So actuellement là nous ka occuper on chay moun qui passe à payer pour yo ça acheter remède, moun qui passe à payer pour yo ça ouais docteur, moun qui passe à payer pour quantité différents bagay. Nous ka assurer dat ki c'est moun ça là ouais docteur, c'est moun ça là joindre traitement dat ki yo supposé joindre. Là ni moun qui pas qu'à prendre vaccin yo, qui pas qu'à vacciner maman yo, toutes ces bagailles ça là nous pour assurer moun prend précaution et puis faire ces bagailles ça là. Là ni moun qui pas qu'à occuper quoi yo bien et puis ministry a un chai programme qui a aider moun faire ces bagailles ça là. Là ni programme qui a indiqué ces moun about bagailles dat qui yo supposé faire. Là ni moun qui a fait ish yo pas prendre pour faire ces ish là. Et puis ministry a ka ba yo différents bagailles pour protéger koyo et puis tout bagaille comme ça. Comme ministry a ka pour un chai marche pour aider un chai moun qui malade. Là on regarde manière nous un chai moun ici là qui ni diabetes. Avec ces moun ça là, on chai yo passe à payer pour traitement là yo ka joindre. Mais nous ka still ba yo treatment. Actuellement là nous jamais été un lot chiffre à sous dialysis là nous take bail puisque nous exorber là ni on chaque monde qui besoin dialysis c'est ici. So nous mettons un chiffre 9 et puis nous ka bail plus monde dialysis pour la petit chiffre 9 ça la date qui nous mettons.
Ministre là aussi parlé du plan ministère qu'a développé pour faire sortir cette liste à ce qui a venu.
Un plan nous avons développé par Saint-Lucia, c'est un plan qui a parlé pour moun avant de venir malade. C'est ça nous avons créé preventative care. So nous voulons aller au docteur si c'est 2-3 fois par l'année pour make sure pour assurer que ou pas joindre malade. Si c'est un petit malade ou ni, nous voulons assurer que petit malade ça là ou joindre assez bon ou savent about li assez bon. So that ou ça aller ouais docteur et puis docteur ça occuper ça ba ou. Nous pas vle plan nous ka mettre en place à ces côtés nous pas vle moun espérer juste là yo ja trop malade et puis docteur pas ça ba yo guérison encore pour yo ça juste souhaiter là sur couche l'hôpital et puis nous savent ça qui arrivé yo. Nous voulons yo aller ouais docteur en avant yo vini malade tous les l'année ou ka check quoi so that ou pas kay vini malade sans nécessaire avec nous kay chebe maladie il juste un commencement et puis pas les déjà trop tard. So ça c'est première part en dedans plan là avec après ça nous regarder toutes les autres maladies nous ni avec regarder comment nous ça ba mon remède comment nous ça occuper mon so that nous ça arrêter à dans ces malades ça là. Là ni moun nous just ni pour ça aider yo et puis ba yo remède et puis ba comme ça parce que dans maladie j'ai pauvre trop avec c'est ça nous voulons empêcher fait pli en dans plan date qui nous ni pour cette lycée nous savons nous ka sorti vieux l'hôpital là Victoria Hospital puisque vieux l'hôpital là est très vieux et puis on chay bagay ka tomber so quand yo ban nous l'hôpital neuf ça là European Union na ban nous bel l'hôpital neuf. Nous avons tiré ces gens dans l'hôpital Victoria Hospital et puis mettez yo dans l'hôpital neuf là. Ici côté moun ka occuper santé yo avant rien rive yo. Nous voulons cette ici côté moun pas ka boire quand room dat qui yo ka qui était affecté tout organe dans corps yo. Nous voulons un pays côté moun ka prend responsabilité pour santé yo. Plutôt pour yo quitter quand yo vini malade et puis pour yo lager quand yo à ce compte gouvernement. C'est qualité pays ça là nous voulons un système côté moun ka prend vaccin yo, moun ka ay occuper docteur yo avant yo vini malade et puis moun qui ja malade qui besoin que yo ka venir l'hôpital, yo ka venir dans ces health center, ces cliniques là. Avec nous voulons Saint-Lucien savent dat qui nous ni clinique tout partout dans pays. Mais c'est pas toute clinique qui a couru à même les jours yo vle courir. Là ni les pour ces cliniques là courir et puis nous voulons ces moun connaître qui les cliniques là ka courir pour ça là dans ces cliniques ça là pour ça occuper.
ministeri sati ni plan pou mette chay pez a sou ka sati avan moun veni malade, sa vle di preventative care. E oui, bi non. Repons la se oui.
The Strategic Planning Unit at the Ministry of Health and Wellness is the government's think tank. The right hand of the Permanent Secretary, they plan, execute, evaluate and assess the services of the Ministry. Here's Dwight Calixte, the Ministry's Chief Strategic Planner.
I guess I could start with the history of our department. The department started with 3 persons, the Chief Planner, the Secretary, and the Projects Officer. That was the core of the unit at the time. As the unit grew, it grew to an expanded mandate of the ministry with respect to health reform, and it grew from the 3 to now. I think we have almost 10 persons within the unit. And it grew to reflect the different services that are required and the different functions of the ministry. So, for instance, we have, as part of the unit, we have a health planner, we have a social planner, we have research officers, we have a projects unit, and more recently we have added the quality and monitoring evaluation components to the unit. The Ministry of Health has a very key mandate in terms of protecting the health of the nation. That is our primary mandate. But within that, there are many facets. We need to look at policy formulation for the health sector. That's key to the Ministry of Health. We need to look at monitoring and evaluation of our health status, because we have to plan and deliver programs with respect to the changing health profile that we have. We have to look at setting the standards, okay? Because if we are to deliver services, it must be to a particular standard, to a particular quality. We also have a clear mandate with respect to informing the public with respect to health education, ensuring there is a competent and reliable workforce to deliver the health service that we are supposed to, as well as doing the overall, not only in the public sector but the private sector, monitoring of that entire health sector. So within there is this broad mandate that we are charged with, and it speaks to ensuring that there is a health sector that could provide efficient, reliable, timely health services to the populace. By way of achievement, we have been able to, in keeping with the mandate for health sector reform, to produce our National Strategic Plan, within which sets out some of the core principles in terms of health service delivery. I'm proud to say that we, as a unit, from the beginning of every budget year, assess the resources given to us within health, and we implement the full capital program. We also work with each of the heads to monitor and implement their programs, and it's through these programs that we are able to meet those health gains, those positive health outcomes. So whether it is environmental health, whether it is Victoria now OK EU, whether it is Groseley or Soufre down in the south. We are the officers that integrate and interface with the heads to ensure that these programs are implemented. So we have some small successes under our belt. The health information system started with a thought with corporate planning and epidemiology. The new national hospital also started with a thought and putting in place the necessary requirements that the EU now accepted and gave us that the biggest gift that they have ever given to any single country within this particular region. So we are the movers and shakers in the background. We are the ones that sit and work through the night to ensure that these programs are met, these programs are delivered. I know we don't take any accolades, but the team and myself, we work very hard to at least achieve those health outcomes.
Mr. Calixte continued by giving a description of the health sector and the overall services provided by the Ministry of Health and Wellness.
Preference to the strat plan and the services and our core, the delivery of our core set of services. Our strat plan has 7 core drivers. We have 7 core drivers, and with that, I'll move into the description of how we deliver those services. So we have organization and management. We have sustainable health gains. We are looking at efficiency, cost efficiency, and effectiveness in terms of the delivery of services. Information system, infrastructure, quality. These are the core drivers of our health system. And all of that is delivered through a core infrastructure. We have, at present, 33 health centers with 2 general hospitals, both which are essentially on its way to completion. We have 2 district hospitals, that's Dennery and Soufre, and we have a polyclinic. So within that infrastructure, the Ministry of Health actually delivers its core sets of services: health promotion and education, disease prevention and management, diagnostic services, treatment and management. So when we speak of non-communicable diseases, the treatment and management is delivered through the length and breadth of the island, through our wellness centers, through our polyclinic. Disease surveillance and outbreak investigation and management, rehabilitative and palliative care. So that speaks to the services, our secondary services delivered through our hospitals and our tertiary institutions, the mental health, and also Turning Point. With respect to our general services, the Ministry of Health is responsible to deliver our within the infrastructure that we have for the health sector. We deliver core services like health and education, health promotion, our disease prevention, that speaks to environmental health, our port health programs. And given the new and emerging infectious diseases, we're now dealing with chikungunya, Zika, H1N1. All of these are essential in terms of doing our disease prevention. So environmental health becomes very critical in terms of food management, water investigations to ensure that we have good potable water and so on. So very important. We also look at diagnostic services, palliative care, and rehabilitative services. And these are the core services when we speak of our secondary services and tertiary care. That covers services at our Millennium Heights complex, which now would house our Owen King, our mental wellness, and our Turning Point institutions, as well as St. Jude's. Some of these services are now also delivered within our district hospitals, which is Sufra and Denry. We also look at treatment and management, pharmaceutical services, disease surveillance, and outbreak investigation. All of these are delivered through the length and breadth through the wellness centers that we have spread across the island.
Question. The Strategic Planning Department answers all your needs in the health service. True or false? Answer. False. The Strategic Planning Department plan, execute, evaluate, educate and provide access to health services. They are the government's think tank.
Ada ministère de santé, nous n'ayons unit, ça c'est corporate planning. Qui n'est responsabilité pour conduire direction ministère ka ale. Unit sala aussi n'y a go rôle pour jouer a qualité service la ministère ka offre man public la. Yo aussi n'y responsabilité pour faire plan et revisiter ces services là au secteur santé. Yo go achievement unit corporate planning c'est côté avant un temps passé, yo te ni 3 travailleurs seulement, mais après unit là ni à peu près 10 travailleurs. Chef officier qui est responsable pour plan secteur santé, Dwight Calixte, parlait de l'importance là pour assurer qu'il y a pour jouer même public là et puis un service santé qui est bon et available. Monsieur Calixte dit que le ministère ni une responsabilité pour protéger la santé même public là et puis pour raison ça là, il besoin développer une policy pour le secteur santé qui peut revisiter côté cette lycée, les venus pour place nous en ligne de santé. Ministère de santé aussi ni pour mettre plan et programme en place qui a une ligne et puis environnement santé qui a changé. Yo aussi ni pour assurer ces travailleurs santé en ordre pour délivrer service santé qui est bon standard. S-Unit Corporate Planning responsable pour assurer ministère de santé qu'à aller en bonne direction. A. Oui. B. Non. Réponse là c'est oui.
St. Lucia's primary healthcare consists of community-based care, immunization and mental health. The St. Lucia National Mental Wellness Centre is a specialized healthcare facility which provides psychiatric care. It is located at the Millennium Heights Medical Complex in Castries. To tell us more about the St. Lucia National Mental Wellness Centre, here's its Executive Director, Jennifer Forrester.
The St. Lucia National Mental Wellness Centre is a tertiary care facility. It is one of the facilities of the new Medical Heights Complex. It was established in 2010 or commissioned in 2010 as part of the national policy towards mental health reform. We have 110 beds at this facility, and part of which of those 110 beds is specially dedicated to children and adolescents. All of our services are free at the Mental Wellness Center. The Mental Wellness Center services are guided by the Mental Health Act of 2001. There is also a current revision of the Mental Health Bill of 2008. This, however, has not been passed and enacted by Parliament. We are currently guided by the Mental Health Hospitals Act of 2001, and in addition, there is a current revision of a mental health bill of 2008. It's under review. It has not been passed and enacted by Parliament, but this is also an upgrade when it is passed by Parliament to our mental health, to support our Mental Health Act of 2001. The facility was just one component of the mental health reform project, which is a national policy. And this also encompassed the mental health reform also included legislation, and I spoke of the Act of 2001 and also the revision of the bill for 2008. and it was also supported by mental health policy. So moving from Golden Oak Hospital into this facility here was really a welcomed and needed addition or expansion of mental health services, improvement of mental health services, where we offer our services in an environment that is user-friendly and that patients can be able to be rehabilitated towards providing being a part of the society. Our services are all offered free to the general public, and what we do, we are constantly striving to ensure that our services are always improving based upon the data we collect here and also our national statistics. And based upon this information, we have recently introduced, or at one point we introduced, a child and adolescent unit for children only. We also recently introduced an in-house dental clinic. All of the services are free. It is a comprehensive service to the public. We are strengthening our psychological services to the public as well. And we also established a national helpline. This is the 203 helpline that is used. It is manned by 24 hours by trained call responders. And this is what we are offering at the facility. I just want to assure the public that our services are here confidential, and despite the fact that we all know that there is a stigma attached to mental illness, we at the service strive as much as possible to be professional and to provide care in an environment that is very conducive and supportive towards ensuring that persons are rehabilitated and can function in their day-to-day life.
Call the St. Lucia National Health Helpline from any phone at any time. The number is 203 and it's free. The helpline provides services for persons having suicidal thoughts or other overwhelming emotions. Question. The St. Lucia National Wellness Centre's services are confidential and provides care that is supportive to patients and their families. True or false? Answer. True. Services at the St. Lucia National Wellness Centre are confidential and provides care in an environment that is conducive and supportive to patients and their families so that they can all have a better quality of life. Question. The St. Lucia National Health Helpline number is 203. True or false? Answer. True. If you have suicidal thoughts or other overwhelming emotions, call the St. Lucia National Health Helpline by dialing 203 from any phone at any time. The call is free.
A secteur santé la ni zafè di santé sévère, ça c'est mental health, qui est bien important. Et puis c'est pour raison ça la, ministère de santé te way nécessaire pour établir un centre mental wellness, qui kay poursuivre service psychiatrique. Et ben ça veut dire a place côté moun qui ni problème et puis sévère yo, ça joine traitement. Centre mental wellness là, te établi en l'année 2010 et aussi ni à peu près 200 travailleurs. Centre ça là aussi un pas et puis policy gouvernement pour faire changement en affaires santé sévère. En facilité ça là, yo aussi ni à peu près yon sans discouche qui yon ni spécialement pour ti mamay et jeunesse. Tout service yo ka offert en facilité a, c'est pour rien. Moun pani pour payer pour service là. Directeur pour Center Mental Wellness là, Mlle Jennifer Forrester, dit que l'organisation travaille bien pour assurer service là yo ka offert vini plus meilleur. Pour raison ça là, yo ouvert unit pour ti mamay et jeunesse, yo aussi ouvert clinique pour affaires santé bouche et puis aussi établir helpline côté moun qui ni problème et be ka kachile trikoyu. Ça veut dire suicide, ça kuye numéro 203 n'importe le yo vle parler et puis professionnel et qui yo kay joindre assistance. Yo si pa kay ni pour payer rien pour service ça là. les ou sa di nou ki kalite servis yo ka offer a center mental wellness la. A. Zafè santé sevel. B. Zafè santé bouche pou moun ki ka vizite center. C. Démarche helpline la pou moun pale di problem yo. Réponse la si, yo tout se servis yo ka offer.
Have you ever felt stressed, anxious or overwhelmed by sudden situations? I know I have, many times. The St. Lucia Health Helpline has been instrumental in listening and helping people to manage their mental wellness. Emotional distress can be extreme at times to the point that people become suicidal. We should not be afraid of or hold on to stigmas about the Mental Wellness Centre. Care is provided by a team of professionals ranging from psychiatrists, clinical counsellors, clinical psychologists, social workers and occupational therapists, and they are supported by the nursing team, pharmacists and non-clinical staff. I asked Dr. Julius Gilliard to tell me about the services provided and the helpline.
We are trying to extend the clinics to Wednesday. So Wednesdays we're trying to start off a child psychiatry clinic, child and adolescent psychiatry. So the Mondays and Thursdays would continue as the adult psychiatry clinics, and the Wednesdays would be specifically for children and adolescents. As well, what has been happening is that we've had an improved staffing of the department. So whereas before, when I came here 2 years ago, it was just 3 consultants. We now have 3 junior doctors as well. So the services that we would offer to the persons who come to the clinic, as well as the persons who are admitted to the units, would be improved because they would have more regular visits by the doctors, and we're now able to discuss cases among ourselves and reach better decisions with regard to patient care. In addition, we've had improvement in the psychological department in that we've had another psychologist or clinical psychologists come on board, so that the counseling is not only done by 2 persons, and I know before those persons would have been overwhelmed by the workload, and now that is shared a little more, and we get a lot of assistance from the counselor of the helpline, who as well shares in the counseling workload that the department experiences on a day-by-day basis. I think the public needs to know that mental illness should not be demonized. So we live in the 21st century, and whereas before it was demonized and persons were convinced that it was a spiritual thing, we're now sure that it is not. And there is help. So anybody who is experiencing any kind of mental distress, and this is what is important. So persons who are distressed mentally are those who either seek help or are brought for help by their family members. And those persons can be assured that the help is available at the Mental Wellness Center, that we do have staff who are qualified and who are trained to help them with whatever situation that they may be encountering. So like I said earlier, persons who are acutely ill and severely ill who may need admission to hospital, if it's a first-time admission, they would need to get a referral or clearance from an emergency room or a general doctor, and then they would come to the center for admission if that is necessary. And we see all kinds of patients. We see from patients who are acutely psychotic to patients who are suicidal and who may be at high risk of attempting suicide, or persons who have attempted recently who are still at high risk. So those persons can be treated either via the inpatient wards, or if the illness is not acute or not severe, then they can be seen at the outpatient clinic. But the help is available for everybody who needs it. It's called the St. Lucia National Health Helpline, and it was started in 2015. The government at the time saw the need for the services that are offered by the helpline. At the time, the suicide rate was between 13 and 15. What happened is that after the helpline was started, the rate went down to about 7, and that continued from 2015 until 2017, when the rate went back up to about 12. I'm not sure what was happening at the time, but in 2018, the rate went back down to 3. So far this year, we've had 3 suicides, 3 completed suicides. The services that the helpline offers are that somebody who is feeling distressed, somebody with a lot of emotional distress would call, and the responder would help them with those emotions. If they would do an evaluation of the person, so if the person is at high risk of suicide, then a safety plan would be done up with that person or with a relative of the person or a friend or whoever is close by. If that person is not able to be kept safe, then advice would be given to the person on the end of the line that they should take the person to the nearest emergency room. If that person does not have somebody who is able to do that, then the police would be called and that person would be taken to the nearest emergency room for evaluation. And if need be, they will be brought to the wellness center for admission and treatment. If there is no risk of suicide or low risk of suicide, then an appointment would be made for that person to see the helpline counselor. The counselor would then help the person work on the emotions that they're having at the time and any other issues that they may be going through. A lot of the persons who call are persons who are depressed or very anxious or have issues that maybe came up suddenly that are making them feel overwhelmed. So those would be worked out with the counselor, and that person would be, you could say, would be brought to a better place emotionally before they are discharged from counseling. The helpline is, persons are not as sensitized as they should be to the helpline, but it's catching on slowly but surely. We have had programs over the last 2 to 3 years where we're trying to bring the services more to light in the public. So, for example, last year we had an entire week for Suicide Prevention Day. That's in September 10th last year. And that culminated with a health fair in the Constitution Park, where members of the public were really taught about suicide and the services that are available in St. Lucia to help them when they're having thoughts of suicide or any other distressing thoughts that would put them at risk of attempting suicide.
Question. The St. Lucia National Health Helpline is for people with mental health issues. True or false? Answer. False. The St. Lucia National Health Helpline is for everyone, so whether you are concerned about your wellness, mental or otherwise, a trained counsellor is available for support and guidance. The service is confidential and manned 24 hours by trained call responders.
Aba démarche la pou ménager maladie sévère à cette lisi, c'est helpline la, qui Center Mental Wellness la ti établi. Depuis établissement helpline la, gouvernement jawe gros progrès côté moins moun jachwe koyo, sable di suicide. Yon psychiatrist, Dr. Julius Gilliard, parle de l'importance là pour cette lycée pour qu'à sortir sévère là.
Cette lycée ni pour savoir que sortir sévère yo important. A chaque monde ka kwe c'est que depuis yo pour que koyo yo kay alright mais sévère là ka contrôler quoi. A chaque monde ka tout jour par jour yo ni stress ka dilepi. Bon, c'est moun ça les yo si yo pas connaître qui manière pour dilepi stress là, et ça commence à affecter yo. Si commence à affecter sévère là, yo peut arriver à l'état que yo depressed ou yo commence à développer anxiety ou l'autre maladie qui ça fait yo quand c'est moun là ka dit à la oui yo ka fait yo créer quoi fou. Comprendre pour empêcher tout ça arriver moun ni pour commencer à porter sévère yo pli. Si un moun ni problème yo commence à dépresser yo commence à développer anxiety ou l'autre maladie sévère yo ça approcher wellness center là ni docteur qui ça ouais yo qui ça m'a des questions pour savoir exactement ce qui ça yo ka passer et si yo besoin remède yo kay jeune remède si yo besoin ouais un psychologist ou counselor yo sa refer yo pour un counselor pour deal et puis ça yo ka passer. Nous avons deux cliniques, les mardis bon matin et les jeudis bon matin. Nous avons pris un try pour mettre à l'autre clinique les vendredis, les mercredis, Les mercredis pour ces mamans là avec ces teenagers. Que so laisse ça commencer, public ils savent, puis ils peuvent mettre à la radio. Bon, c'est à ces cliniques là, là toujours des docteurs. La toujours des counselors aussi. Comme on dit, les docteurs, ouais, ces gens-là, ils referent pour service là qui fait plus bénéfice. So si vous avez besoin de counselor, vous referer au counselor. Si vous avez besoin de remède, ou si vous avez besoin l'aider, vous mettez là et counselor, vous pouvez faire un arrangement pour jouer un service là.
Est ou sa dit nous et puis service helpline si un monde sa joindre ça fait conseil available n'importe les couiller et oui B non réponse là c'est oui.
The Ministry of Health and Wellness provides dental services for everyone, but the ministry also has a surgery specifically for patients of the St. Lucia Mental Wellness Centre, where they can receive many procedures like cleanings, fillings and extractions. I asked Dr. Janine McIntyre about the services the unit provides.
We do consultations, examinations, cleanings, fillings, extractions. We also give oral health education to the patients, and on occasion we go to the units to help them with their proper toothbrushing techniques. I think most of the patients are very eager to have their teeth cleaned because some of them, because they don't get that access at the health centers and you have to pay for the service, they haven't done it in a long time. So when they hear the services provided here, most of them come in and ask when can they clean their teeth. We say that a lot also. We see quite a bit of extraction because there's a fee and some persons might not have that money to pay. They might have something they have had in a while to attend to, and then when they go to these services, they come and ask if they can get their teeth extracted if they have something pending. When they come in, we either get them through, we get them for a referral form when they come in as patients, when they're admitted. The doctors see them, they give us a referral and we see them, or if they come from out and they see the doctor, they give them also a referral form to see us. So they're always referred by the doctor before we can attend to them. Generally, people don't see dental care as important as maybe going to a doctor for a general checkup. But what we want them to know is that your oral health is the gateway to your overall health. We need our teeth to chew our food, to nourish our bodies. You need your teeth for your smile, to maintain your face structure. You need your teeth to speak clearly. Also, with bad oral hygiene, people are at risk for gum disease, periodontal disease, chronic disease like diabetes, stroke, heart disease. Pregnant mothers also, if they have bad oral hygiene, it can also be an increased risk for them to have premature babies. So persons need to know that going to the dentist regularly is very important, at least twice a year, and they need to put it on their schedule like something they have to do, not just something if you have a pain or something bothering you that you have to go to the dentist.
Question. Dental services for patients at the St. Lucia Mental Wellness Centre include cleanings, fillings and extractions. True or false? Answer. True. A fully equipped dental surgery is available at the National Mental Wellness Centre for patients. More services are provided here than a regular health centre.
Ministère de Santé aussi way to important pour poursuivre service dentiste by ces patients là a center mental wellness là. Ces patients là ni opportunité pour joindre service dentiste qu'on nettoie dents yo, faire fillings et aussi washer pièces vides dents qui bouche yo. Yo aussi ka poursuivre patient et puis formation à sous manière pour point ka bouche yo. Yon dentiste a center mental wellness là Dr. Janine McIntyre. Parler de l'importance là pour moun point ka de yo. et ki servis dan avelab bay patient ki ka visite, ek sa ki ka westi a center mental wellness la. Es ou sa di nou, ki les servis danti se patient la an center mental wellness la ka wisivwe? E. Netwaye dan, B. Fe feelings, C. Wache piyes vede ki yo bouche, D. Informasyon a sou manye pou pwe ka bouche. Repos la si, yo tout se servis yo ka ofre.
The Primary Care Department provides health services of a preventative nature, promoting health and wellness among the population. Health education and promotion is critical in reducing illnesses and diseases and lessens complications from diseases. Immunization plays a huge part in preventative care, and it's an area that the Ministry of Health and Wellness can boast many achievements. Nurse Julietta Frederick-Cassius tells us more.
Okay, so the role of community health nursing service is to be able to coordinate all of the activities within all of the wellness centers on the island. So we do have 34 wellness centers that provide primary care services. And when we say primary care service, we talk about preventive health. We're talking about working with individuals, families, and communities to help them promote their health and also to maintain wellness. So our focus is not on diseases, but our focus is on promoting and maintaining health within the community. We have done quite a bit of improvement with our services. We have increased certain services that we were not offering before and also strengthened on some services. For example, we have introduced the diabetic retinopathy program. We have been working with the public in terms of increasing eye screening throughout the islands, but we have enhance that program by including a component of diabetic retinopathy, where all diabetics are going to be screened. They will come into the facility, and persons who require laser treatment will be managed accordingly. Also, we have improved in our immunization program. We have introduced certain new vaccines into our schedule, and that has worked very well for us in terms of improving our vaccination coverage and also reducing outbreaks of diseases that can be prevented through vaccines. In addition to that, we have also increased our specialist clinics in terms of obstetric and gynecologists. So we do have an obstetrician and gynecologist on island who goes throughout the wellness centers to be able to provide that kind of care to our pregnant women. Also, we have our pediatric services throughout the islands as well, and also in terms of our podiatry. This is one of the services that we've not had for a while, but for over a few years we have been able to introduce that service to be able to provide foot care and foot assessments for our diabetics on that island. So overall, with the help of external partners, we have been able to train and retrain our nursing staff and other staff to be able to improve on our services and also include new services into our program. Also, we don't only work as a nursing team. We work with other healthcare professionals as a team to be able to coordinate our health activities. So we work with the dental department, we work with the Bureau of Health Education, we work with the nutrition officers. So it's really a team approach out there in the community to be able to provide that kind of level of care to individuals, to families, to communities. Also, we have increased a lot on our outreach programs. So we realize persons' pattern of accessing care has kind of shifted. So to increase accessibility, so we actually go out into the communities. We target various groups within the communities to be able to further make available those services to persons who otherwise would not be coming into our facilities. We do provide quite a bit of services in the community at further wellness centers and also in the community as well. So we have antenatal services, we have services for pregnant women, we have for the mother when she delivers, so we care for the child as well. We have pap smears that we offer to our women. Let me just say generally cancer screening, because not only for the women, but we also have cancer screening for the men. The men can come into the facility and get screened, and we can send them for necessary investigations. We also, over the years, have tried to include our men in our clinics, because we realize this is one such group that we have not placed a lot of focus on. So we actually have some facilities that do have men programs targeted for just men. So where we want to encourage the men to come forward, you know, and to give them, empower them with information that they can make informed choices about their health. So in terms of the public's perception of our services, even when talking to persons within the community, they are not aware of the services, the multitude of services that we offer in the community. And we do provide a wide range of services at the wellness centers in terms of encouraging persons to promote wellness with themselves, of course, and with their families. So in terms of the services, persons are of the belief that is of a poor quality, which is really not so. Our services are of very high quality, and also they are offered by trained, experienced personnel within the community. We do go through refresher courses, we go through training just to be updated and abreast with current trends and in terms of management and care of persons. And that includes persons with chronic diseases, that means the pregnant woman, that means the child. So it's a wide range of services that are available in the community, and persons need to know what services there are. So we encourage persons to visit the wellness centers, have a discussion with the staff there, to be able to identify what are the services that are available and the services that are of interest to them and they can take advantage of.
Question. Podiatry is available to all and provides foot assessments and care, especially for diabetics. True or false? Answer. True. Podiatry has been reintroduced to provide foot assessments and care, especially for diabetics.
Departement Community Nursing Service se yon ki responsabilité pour poursuivre cette liste et puis service santé qui kay aider pour empêcher différentes maladies et assurer bonne santé parmi la population. Département a aussi coordonné activités à ces différentes places santé à cette liste. Un effort pour couper à ces différentes maladies et problèmes de ces maladies là. Département aussi quoi est important pour éduquer moun à sa santé yo. Yon gros achievement département c'est démarche là pour joindre plus moun vacciné contre différentes maladies. Yo cité fait gros progrès au service là yo ka offert qu'on peut capier pour moun et puis maladie pisadou, service gynecology et service pour casier. Dernièrement, yo aussi fait progrès au démarche là pour visiter moun en si commune là qui passe à venir à l'hôpital là et be place sortie. Yon de ces gros achievements département Community Nursing Service. Ce service là yo ka offert qu'on peut capier un moun et puis maladie pisado. Et oui, non. Réponse là c'est oui.
The Bureau of Health Education's main aim is to influence change in the environment by educating individuals, organizations and society to help improve their understanding of health issues. I asked the Director of Health Education, Natasha Lloyd-Felix, what role the Bureau of Health Education served in the ministry.
Within the Bureau of Health Education, what we do is bring health to people. We're very people-centered, people-focused. Essentially, what we bring is heart to health. So we know typically health is seen in a very clinical way, and persons sometimes feel detached from the messaging. They feel that they're not sufficiently au fait with issues pertaining to health. So what we try to do through our programming is improve persons' understanding of health issues, whether it be preventative health or persons living with conditions that they know how to better manage their conditions. Our approach is through an ecological model, which simply means we look at various levels of intervention. We look at it through the individual, the family, the community. We look at organizations and communities, and then we look at the overall structure of society, be it through policy interventions. And so as a result of that, we have a very all-embracing approach to health. We look at health in a way that we can influence change, not only for the individual, but the environment within which individuals live, individuals work, and socialize. So in terms of what we do, our programs are centered within settings. As a result of that, you find that our interventions happen in schools, communities, workplaces, and as a result of that, we target various audiences through our interventions. So though we look at health across the board, we realize that issues vary depending on which audience we want to reach or target. Through the department, our services are delivered within various settings, priority settings, which would include workplaces, schools, communities, and within our health institutions. We reach specific target audiences, which would be our school children, persons within active employment, etc., because we recognize health issues vary dependent on who it is you want to provide a health message to or deliver health information to. As a result of that, what would happen is that our programs would be aligned to the needs these audiences have. So within a school setting, for example, we would be given information on healthy eating habits, which would be supporting what has happened with the nutrition department with their own interventions. Within the workplace, we would look at how we encourage health practices within a working environment, and so that persons can adopt healthy habits not only within their homes but within their workplace settings. And by doing that, what we find is that we are better able to align programs to the needs of the audiences we want to reach. A lot of the interventions we undertake look at determinants of health. So we don't only look at persons' current health status, but the factors that influence their health. And we know there are a number of factors that would result in how people's health is manifested. So these would include things like your current status in terms of employment or not being employed. We look at gender factors. We look also at resilience issues, whether the person is within a setting of family support or not. So all those come into play, and as a result of that, we work with a range of agencies, not only within the Ministry of Health, but outside of it, be it other allied government agencies, NGOs, community organizations, because all of these influence and impact our health outcomes to some degree. Within that, we have a number of programs that we implement, one of which I think has been identified as one of our markers of success is the Chronic Disease Self-Management Program. This program has been supported through funding from the Pan American Health Organization and has been endorsed by the Stanford University and is globally implemented. It's a standardized program, and St. Lucia commenced our programming in 2015. During that time, we have been able to train persons to be trainers and implementers of the program. That program specifically targets persons living with chronic conditions, cancer, diabetes, hypertension, etc., as well as their caregivers, because we know that chronic disease is a critical issue within St. Lucia. Now, knowing what I indicated earlier, that health promotion and health education looks at improving persons' understanding of health issues, that program is developed especially along those lines, that we're looking for persons to understand their health issues and better control the health issues. But apart from looking at whatever condition they are diagnosed with, we look at the determinants of their health, their eating habits, their budgeting. We look at things like stress, all the factors that would influence health. So that way we look not only at being living or diagnosed with a condition, but factors that influence the condition, the determinants of their health, so that those persons can better manage and prevent complications of their diagnosis. To date, we have done a number of training workshops, and we have done it across the island, and so we have found that the response over time has been improving because others have been able to indicate the benefits that they have achieved by undergoing the program, which actually runs for 6 weeks. We have had persons who have been able to reduce their dependence on medication for management of their conditions. We have had persons who were smokers who have actually been able to quit their habit of smoking. Persons have reduced alcohol intake. So the results have been real, tangible results, all of which we know can improve health outcomes. So it's not only about providing information, but also providing skills, and that's critical to what our department does. It's one thing to have the information, but to being able to provide persons with the skill sets to manage is what adds the value to what we do. So it's not just for persons to be able to know, but also for them to be able to do.
Question. An ongoing health educator is St. Lucia's Chronic Disease Health Management Program, which targets people with chronic diseases like cancers, diabetes and hypertension. True or false? Answer, true. St. Lucia's successful Chronic Disease Health Management Program is a globally implemented program. It looks at factors that influence health like eating habits and stress, so that patients are not just living or diagnosed with a condition, but can be influenced to better manage and prevent complications of their illnesses.
Bureau pour Éducation Santé, ça c'est Bureau of Health Education, ni responsabilité pour mener changement environnement, par démarche là, côté yo ka éduquer moun, organisation, et société pour aider yo faire progrès en manière yo sa agir et puis problème santé. À la fois pour délivrer commission santé, bureau aussi ni programme en place côté yo ka faire travail à l'école là, commune là et place travail moun. Yon gros achievement bureau pour éducation santé c'est programme là Chronic Disease Self Management. Programme ça là c'est yon qui ka produire support by moun qui ni maladie comme cancer, pressure, pisadou, foie et plusieurs les autres maladies. Ça yo ka créer condition chronique. Programme ça là c'est yon qui joine support organisation pour sortir kawaib la parou et ja bay moun étonnement pour travail et puis cette lessier pour ménager maladie ça là. Est ou ça dit nous qui laisse programme un bureau pour éducation santé qui avait là pour produire support by moun qui ni maladie comme cancer, pressure, pisadou, foie et plusieurs les autres maladies. A. Disease management. B. Chronic disease self-management. Réponse là c'est chronic disease self-management.
Visit your community's places of health and wellness. Talk to their staff. Learn about the services that interest you and take advantage of them. Many of the services are free. Ask staff if the services you require aren't provided at your local centre, where you can go, and in some cases, once a doctor's referral isn't needed, staff at your local centre can make an appointment for you. Men, don't forget there are many services that are developed and provided just for you. The Ministry of Health and Wellness has professional teams with ongoing training. Don't let your assumptions keep you stuck in fear. See you next time when we explore our health service. Goodbye.